Laser skin resurfacing is most commonly used to treat sun damage, acne scars, wrinkles, and just irregular skin. Hello, I'm Dr. Robbins, a board-certified plastic surgeon at Des Moines Plastic Surgery, a world's leading clinic. Today I'm going to walk you through what laser resurfacing is and what to expect. So what exactly is laser skin resurfacing? So there's lots of lasers out there. Some are more aggressive, and that's laser resurfacing, which is more ablative. So we're taking off layers of skin versus other lasers that we do also offer here. They're less aggressive, more for maintenance and sort of slowing the aging process down. If someone presents to the office and they have pretty significant sun damage, brown spots, texture, tone, deep wrinkles, some of these less aggressive lasers are really not going to give them the results that they want, and that's where laser resurfacing comes in. And so laser resurfacing can treat a wide range of conditions. I would say the most common are texture, tone, deep wrinkles, acne scars, discoloration, pigment would be the main things that we're treating with laser resurfacing. So here at Des Moines Plastic Surgery, we use the Cyton resurfacing TRL laser, which is considered the gold standard for resurfacing on the face. So what's a good candidate for a resurfacing laser? I would say the best candidates, the most common that we see, are those that have deeper wrinkles, want a more profound difference, more pigment, more sun damage, older. There's no real defined time. I would say younger patients typically don't have deep wrinkles or extended sun exposure, but we're treating acne scars maybe they had when they were teenagers. But I would say with any kind of procedure, people with realistic expectations, they're non-smokers, they're not actively sun tanning, and there's a protocol that we want you to follow before and after when you get a laser resurfacing. But generally, good expectations that are in line with what the laser can do, and healthy non-smokers. This laser, you can tune it and you can make it more aggressive or less aggressive, but one thing we have to be concerned about is how do you respond to the sun? Are going to damage someone's normal pigment to their skin? And those are concerns that we would discuss. So how long does laser resurfacing take? It really depends on a couple things. One is what areas are having treated. If it's multiple ones, it's the full face. I would say full face takes about an hour, and that's done with local anesthesia, topical anesthesia, and also some sedation. If it's more just a isolated area, common areas that I treat with the laser resurfacing are around the eyes, the crow's feet, the lower eye is a really common area. And then around the mouth is probably the most common isolated area of the face that we do, or combinations of smaller areas that's less than the full face. So I would say around the eyes, probably take about 20 minutes. Around the mouth, depending on how deep we need to go, maybe 30 minutes. And those are done under straight local anesthesia, just numb it up with topical medicine and then injections of local anesthesia. So what does recovery look like? I'm very upfront with patients in terms of what to expect. I don't want any surprises. Laser resurfacing works great, but there's definitely some downtime. Depending on how deep we go, which most laser resurfacing, we go pretty deep, and that's the advantage of it. We're removing layers of skin, so there's gonna be kind of a red, raw surface. That usually lasts for about a week, and we have a very specific protocol that we'll go over and that we want you to follow to a T, and that improves the recovery process. After a week, you're still gonna be red. Gotta be really careful with sun exposure, use of sunscreen. Again, we will go over the whole process, but yes, expect some social downtime with laser resurfacing for sure. So in terms of recovery, we will go over everything, and we will give you the products that you need, recommendations. The key one though is no sun exposure. You don't want to tan or any sun exposure for several months before, and then afterwards. It's very important to stay out of the sun, while that new skin, that more youthful skin, is going to be more sensitive to the sun. And you can damage the results, you can reverse the results and cause more complications. So yes, moisturizers that we have medical grade products here that we'll go over. You'll meet with an esthetician ahead of time and they'll go over all that with you. Timing for laser resurfacing, I would say our numbers for sure go down a lot in the summer months, just because even if somebody wants it, I'll say you might want to consider doing it in the winter here in Iowa, just not only for downtime and social downtime, but also who wants to have laser resurfacing when it's 100 degrees out in summer. So I would say the most common time of the year that we do it is the colder months. So fall, kind of picks up, but certainly in the winter. So here's what to expect before, during, and after laser resurfacing. So first, obviously, you'll have a consult with me, and I'll go over the whole process, see if you're a candidate, and see what your concerns are that we will address. I will show you before pictures, 1 week after pictures, so you know what to expect, and then 1 month follow-up pictures so you can see the results in other patients that have similar complaints that the particular patient had. And then if it's something you do want to get started with, we always beforehand, we kind of prep the patient, no sun exposure for several months before, stop or at least discuss any kind of current skincare regimen that you're doing, retinols, topically on the face, need to stop those about 2 to 3 weeks ahead of time. And then we'll discuss when to resume all those things. We have all our patients meet with one of our skincare experts, and we do a visual skincare analysis to see kind of what we're starting with, and we'll do another one afterwards so you can see the improvement. The procedure, depending on full face, if it's full face, we're gonna do some light sedation and some local anesthesia. Smaller areas treated, we can just do it under local anesthesia. You need to drive her home. And then in terms of the recovery, we kind of touched on that a little bit. Just the first week's kind of the worst. It's about a week to 2 weeks of not, social downtime, burning, warm sensation. As with any procedure, whether it's a laser or another surgical procedure, someone is always available for you if you do have questions or any concerns. I'm the only surgeon here, so you're gonna get me in the evenings and on the weekends, and I want you to call if you have a question. This is something we do all the time, you don't. So if you're stressed out about something, concerned, always call. If you're thinking about laser resurfacing, we're here to help. To learn more, visit worldsleadingclinics.com.